To the Early RA and the Living with RA support and education programs. We are really thrilled to have with us this evening Karen Yanelli, who is a DPT, physical therapist. And Karen has been giving these presentations to our groups and other support and education programs throughout Hospital for Special Surgery for over a decade. And she's always welcomed warmly because she gives such wonderful presentations and is so knowledgeable about exercise and physical therapy and physical activity in inflammatory arthritis. So without further ado, Karen will be speaking today about physical activity and exercise and inflammatory arthritis. Karen, please take it away. I'm going to share her PowerPoint as you're introducing yourself. Go ahead.
Oh, sure. Hi, everyone. I'm Karen Yanelli. I'm a physical therapist. I own my own practice on 60th Street between Park and Madison. I've been here for 10 years on my own, but prior to that was a full-time physical therapist at Hospital for Special Surgery for about 6.5, 7 years. In that time, I did present many times to this particular support group, the lupus support group, the myositis support group, and I do have a subspecialty in autoimmune disorders, and especially in patients that have autoimmune disorders affecting their joints and muscles. So I'm very happy to present to you today. And we're going to go over some guidelines. And if you have any questions, make sure you just jot it down because the presentation will take about a half an hour. And we are going to be doing some exercises at the end. I will remind you when we get to that point to not do anything that makes you feel pain throughout the exercise. And yeah, I guess we're all ready to go.
We are ready to go.
Just to give you a preview of some of the exercises that we will be doing together, if you're able to. At the end of the talk, they are range of motion based postural re-education exercises and some lower extremity range of motion exercises. In general, us as a population, we sit way too much. We are too sedentary of a population. We work at desks, most of us do at least. And we commute sitting down, or at least if we're working from home, we're typically sitting down and we might not have a great ergonomic setup at home. And since COVID, I would say the amount of patients that I've seen for neck and back pain that is primarily related to their not ergonomically friendly workstations at home has substantially increased. So I wanted to address that because having chronic inflammation in general makes a person's joints stiff. And then of course you have the added just sedentary lifestyle that a lot of us have taken on, adding to the stiffness. So I want to focus on range of motion, posture, to prevent injury and to decrease pain and stiffness in general. So that's what we'll get to at the end. Basic overview at the beginning of this presentation of rheumatoid arthritis and exercise. Everyone pretty much knows people who exercise live longer. It is with or without any sort of inflammatory disorder. Regular exercise in general can reduce overall pain from rheumatoid arthritis, and regular exercise improves functional ability, lets you do more for yourself. Next. People with rheumatoid arthritis who exercise feel better about themselves and are better able to cope with problems. So less depression in general. And again, this is for the general population as well. Exercise can keep your bones strong. Exercise can maintain muscle strength. Next. So I want to just review a basic study that was done by the National Arthritis Foundation. And this was on the effects of exercise and symptoms of rheumatoid arthritis. Exercise and physical activity was proven to reduce pain and improve physical function. So people with arthritis who exercised for 2 hours a week for 2 months straight had improvements in pain and fatigue. People who exercised 2 hours a week for greater than 8 weeks also had an improvement in stiffness. This is just like the baseline study that I remember reading when I started to work with patients with autoimmune disease. I was a new PT, 2 years experience, and I wanted to get all the information I could to make sure that I was, pushing the right thing on my patients, exercise, stretching, everything. And this is a nice, very general, very basic, but large study that was done that showed, yes, exercise decreases pain, decreases fatigue, and over a long period of time, improves stiffness. Next. So, effects of regular exercise on pain, fatigue, and disability in patients with rheumatoid arthritis. So, I like to reference this study because it does compare exercisers with rheumatoid arthritis to non-exercisers with rheumatoid arthritis. So, pain, fatigue, and disability were compared between both groups, the exercisers and the non-exercisers. The exercisers were defined as those who participated in at least 20 minutes, 3 times a week of exercise for 6 months. Next. The non-exercisers obviously just didn't exercise. So this study showed that the exercisers had significantly reduced disability and fatigue. Although other studies have shown that pain can be reduced, this study showed that it did not either increase or decrease in the exerciser group. This finding proved that exercise will not increase pain levels in people with rheumatoid arthritis. Now, that is definitely something that I see often. I see people getting stronger. I see range of motion improving. I see functional independence improving. But one thing that unfortunately can still be there is just a low level of pain underlying, and then of course the flare-ups. But just because that is present in your daily life does not mean that you should not exercise, because everything else can and will be improved. And in a lot of cases, the pain does improve as well. Next slide. So I want to review the latest version of the American College of Rheumatology guidelines for exercise, rehabilitation, diet, and integrative intervention. So we're going to focus on the exercise recommendations. So the findings that this organization came to were based on input and feedback from a numerous amount of authors. All the authors and their disclosures can be viewed online at the website that I provided. You could also read the entire article at the first website I provided. It was just published a month ago, not even 3 weeks ago. Next slide. So the purpose of these guidelines and guidelines of any major organization is to provide recommendations on integrative interventions for the management of rheumatoid arthritis to accompany disease-modifying agents, so your medications. Next slide. All right, so I want to go through this chart with you. So these authors reviewed tons of literature to come up with these recommendations. Some literature, if it was a case study and it was just based off of one person's reaction to a specific treatment, had a very low level of evidence. If a study that was reviewed had a very high level of evidence, it would be a large study, a randomized controlled trial, and a significant finding. So, in general, the American College of Rheumatology can recommend that they strongly recommend consistent engagement in exercise over not exercising at all. Now, I do think that at this point, everyone that's listening to this presentation has been told to exercise at one point or another since they've been diagnosed with rheumatoid arthritis and before that. But I can confirm with you that multiple dozens of authors found that there was a moderate level of certainty in the evidence they looked at stating that exercise is recommended. The next thing is the recommendation below it: conditionally recommended consistent engagement in aerobic exercise over no exercise. Below that, aquatic exercise over no exercise. Below that, resistance. So you see that they start breaking up different types, modes of exercise. The reason they do that is because it is incredibly hard to define what is exercise. So because all of these studies had so many different interpretations of what exercise was, what frequency, what duration, what amount of resistance, they couldn't put together a specific recommendation for you should do, 50% of 1 rep max of this resistive exercise 4 days a week, and this equals progress. So there wasn't enough evidence to do a specific exercise prescription. It is strongly based on the individual. So that's why a personalized physical therapy evaluation, treatment regimen, and program is recommended to start off your exercise journey, because everyone is so different, and that's reflected in the tons of different exercise studies. So next slide. The intervention, so I just wanted to define for you what the PICO column of the prior chart meant. So intervention definitions and examples are provided in that table, and they were looking at the population, what was done with the population, the different subgroups of that study. So comparing to non-exercisers, comparing to one type of exercise to another, and what the outcome was. So those were the 4 major definitions that they dove into when reviewing these different studies. And again, I put the link to this exact recommendation right there at the second point of the slide. Next slide. So to hone in on this organization's strong recommendation for consistent engagement in exercise over no exercise, they found that moderate evidence suggests that regular exercise improved physical function and pain in individuals with rheumatoid arthritis. Aerobic, resistance, aquatic, and mind-body exercise, so usually that would be like balance, meditation, gentle stretches, Tai Chi even, they were considered together in the evidence supporting this recommendation. The exercise type, frequency, intensity, and duration were not formally defined because the evidence on exercise interventions did not support such precision in the recommendation. And there is considerable variation in patient values, preferences, and access to different types of exercise. So meaning every study looked pretty different and had a large variety of different modes and frequency and everything like that. And they just couldn't give a steady amount of exercise time and mode and everything to recommend. So they said, exercise. The specific elements of an exercise intervention should be tailored to each person at the given time and their disease trajectory. You need to consider capability, access, and other health conditions. National physical activity guidelines can aid in such instruction, and we'll go over that later in the presentation. Next slide. So, is exercise safe to perform? This is a question that I've received dozens and dozens of times throughout my career. People are nervous that if they're already inflamed and they're already fatigued, won't they just get more inflamed and more fatigued if they exert themselves? So this specific study is a review of a bunch of studies that focused on safety of exercise in patients with RA. Next slide. Okay, so one of the studies that was honed in on was the difference on the effect of the effect on patients if they did moderate to high intensity exercise versus gentle and conservative exercise. So the moderate to high intensity exercise was defined as getting your heart rate up to as fast and safe pace, as well as lifting weights that stress your muscles to at least half of their potential. Meaning, if you can only do one repetition of a motion, and the most weight you can do is 20 pounds, moderate to high intensity strength training was defined as 10 pounds of that exercise. So it's half of your 1 rep max. So conservative treatment in this study highlighted was described as basic range of motion and gentle muscle contraction. Next slide. So the good news is that both exercise group had an improvement in disease activity. There was a trend towards further improvement with the intensive exercise group, but there was no downside to doing gentle conservative or moderate to high intensity. Next slide. This other study that was reviewed was a study by Nortimar, and this looked at the effectiveness and safety of a supervised and long-term exercise program. I like that they reviewed the study because it was 4 to 6 years in length. So this study looked at patients with rheumatoid arthritis and its damage on the person's affected joints over a long period of time. It showed that when compared to people with rheumatoid arthritis who did not participate in long-term exercise, the exercisers' joints, when x-rayed, had less damage. So I thought that was very interesting to show. Over time, how does the breakdown of the joint compare if you exercise versus not exercise? And this study showed that there was less damage in the long-term exercisers. Next slide. So studies have shown that intensive exercise and weight-bearing activity is not only safe, but it is beneficial for the small joints normally affected by rheumatoid arthritis. And I believe this study was x-raying the feet and the hands. Next slide. So conclusion on safety. I know I only highlighted 2 studies and there's much more that are reviewed in this overall case review study, but conclusion on safety is that people with RA performing moderate or high intensity exercise can improve endurance, muscle strength, functional ability, and psychological well-being in the same time, not being scared that they are causing their body any harm. Conclusion is, next slide. Conclusion is that resistance training increases tendon stiffness and strengthens connective tissue, and cyclic loading enhances cartilage intensity and integrity and joint lubrication, and mobility exercise increase range of motion. This was all the conclusion on this study review. And next slide. And the biggest point to take away is that exercise does not increase disease activity, and it does not increase destruction of the joint structure in the small joints affected by rheumatoid arthritis. Next slide. Okay, so now that you know it's safe to exercise, even long-term, now that you know that you can do moderate to high intensity or gentle conservative and not be nervous about increasing your disease activity, and you're motivated to exercise, what do you do to start your exercise journey? So you would ask your medical doctor and your physical therapist, what exercises are recommended and how often do I perform them? Next slide. So what to expect from a physical therapist? Number one, the therapist should be educated on your condition and overall autoimmune disease. You should be tested, strength, functional limitations, range of motion. Everything needs a baseline value upon evaluation. After you are tested, setting expectations and prognosis is highly important. You should know what a typical 4 to 6 week program will result in. Achievement of attainable goals should be discussed with your physical therapist, and you should use exercise as one of the main prescriptions to achieve that. Next slide. Okay, so let's go through the types of exercise that you should consider doing. Aerobic being first and foremost, my number one recommendation. Not only is it been shown to help regulate the immune system, but it has been shown to basically decrease your risk of any disease, from heart disease to stroke to Alzheimer's, everything. Non-aerobic would be your typical strength training, where you're not demanding a significant increase in oxygen to your body, and it's not going to make the heart pump harder for a longer period of time to give your body more oxygen. So it's considered non-aerobic. You could do a combination, so high intensity interval training, where you're doing aerobic and non-aerobic alternating. And then you've got your basic range of motion, stretching, isometric contractions. This is typically defined as gentle and conservative exercises. Next slide. Okay, so remember when the Rheumatology Organization recommended looking at national guidelines as a basis for an exercise prescription? This is the highly recommended aerobic exercise prescription for the United States, basically. So according to the U.S. Department of Health and Human Services, adults should obtain 150 minutes of moderate intensity physical activity a week to have a substantial overall health benefit. This is recommended to be done 30 minutes a day, 5 to 7 days a week. This exact recommendation has also been stated by the CDC and the ACSM, which are two very highly regarded organizations. I give this exercise prescription to all of my patients. Not many people can start off doing 30 minutes a day. Not many people can start off doing more than 10 minutes a day. And that's okay, because your heart muscle is one of those muscles. Actually, it's probably besides your digestion muscles. It's one of those muscles that you can't really overdo. You can overdo your skeletal muscle and get tendonitis and soreness, but your heart thrives off of exercise. So if you want to do 180 minutes a week, if you want to do 210 minutes a week, even better. But the base minimum is 150. So if you have to start off at 10 minutes a day, 7 days a week, you're at 70 minutes. Great. And you're going to work your way up from there. Every week, try to go up 2 to 5 minutes. You could also break up the 30 minutes a day. You could do 15 minutes in the AM, 15 minutes in the PM. You could do 3 10-minute sessions. Now, those are more convenient. The 3 10-minute sessions or 2 15s. They're more convenient for people that have a gym or wellness center in their building or a piece of cardio equipment in their home. So I always do give recommendations for at-home exercise equipment, especially a stationary bike that is easily, it's easy to get on and off of. Next slide. Okay, so what can you do for aerobic activity? You can do dance classes. I have patients doing jazzercise on Zoom. You can do a fast-paced Tai Chi class. You could do aquatic exercise. Next slide. You can do walking on a treadmill, elevated, high speed. Remember, you do want to get your heart rate elevated while you're doing aerobic activity. So basic functional walking is not aerobic activity. Stationary bike, that's my favorite. Safe, easy to access. Elliptical, I do like that as well. And then the arm bike, if your legs are not able to sustain that amount of time on a lower extremity machine, like a stationary bike or an elliptical, you could always do the arm bike. And you can switch it up. Aerobic activity is not defined by the mode, but it's defined as the heart rate elevating for a certain amount of time. So your heart rate at rest, say, is 60 to 90 beats per minute in a normal individual. You want to elevate your heart rate 20 to 30 beats per minute and hold it there for at least 10 minutes. And that is considered aerobic activity. So the mode of aerobic activity, whether it be like swimming or biking, doesn't matter. Your body doesn't know the difference. your heart is only going to respond to its elevation, your body is pressing for more oxygen, and that sustained amount of heart rate elevation. Next slide. Non-aerobic exercise. So this is, like I was saying, when you're not demanding so much more oxygen in your body that your heart rate has to elevate substantially. Basically known strength training. So modes of strength training: free weights, hand strengthening with putties or grippers, functional activity training and doing it in an exercise prescription. So sit to stand, 3 sets of 10, weight machines. So you get your typical circuit machines, the leg press, the rower, the cable columns. And then my personal favorite, the TheraBands, because they're light, they're easy to store, and you can get them on Amazon for $5. Next. Okay, combination of aerobic and non-aerobic exercises. This is helpful if people are kind of limited for time and they want to just keep their heart rate elevated for the 30 minutes that they need to, but they need to get some strength training in. Circuit training and high intensity interval training is a nice way to do the 30 to 40 minutes of exercise, but get both strength training and aerobic activity in. So for instance, you would do maybe 10 minutes on a bike and get your heart rate going, and get off and directly do 2 or 3 different exercises. Don't let yourself cool down too much. Get back on the bike, do 5 more minutes, get off. Keep your heart rate elevated doing strength training. So back and forth, back and forth. Next slide, please. Okay, so range of motion, stretching, and isometric exercises known as gentle exercises are also very helpful. The studies show that they increase functional independence and decrease pain over time. So an isometric exercise is where you're doing a muscle contraction, but you're not moving the joints. So it would be me holding my elbow up and just contracting my biceps. You're like, oh, look how strong my biceps is. I'm not moving my elbow. I'm contracting my muscle without any motion. That's an isometric contraction. Quadriceps is another popular isometric contraction where you have your leg straight and you're just squeezing your thigh muscles without bending your knee. There's also stretching and range of motion. You can do that with modified yoga. Again, slow moving Tai Chi. Basic, pain-free, gentle stretching and individual muscle. So you have full body stretching and individual muscle stretching and range of motion. Your therapist would easily be able to give you a printout or an email copy of range of motion for every joint in your body. Next slide. So just to review, the review of exercise prescriptions, I want to reference the benefits of exercise in rheumatoid arthritis article right here. Next slide. It has a bunch of good charts on it, and I think they're comprehensive charts. So this chart is a summary of general exercise guidelines for rheumatoid arthritis, and this was derived from the American College of Sports Medicine, and this is the exercise management guidelines that they came up with by doing a literature review. So cardiovascular health, you want to improve that? They recommend cycling, walking, swimming, or dancing. How to achieve cardiovascular health? You want to keep your heart rate at 60 to 80% of its maximum suggested heart rate. So an easy way to figure out what your predictive max heart rate is to take the basic number 220 and minus your age. So for instance, if you're 40 years old, you would take 220 minus 40, and that means 180 is an estimation of what your maximum heart rate should be. You never want to reach your max heart rate when you're exercising, but you do want to get 60 to 80% of the way there. You want to sustain that heart rate as you're doing your aerobic activity. And you want to try to do the 30 minutes a session, 5 days a week, or 60 minutes a session, 3 days a week. That would I don't think anyone really has the time, but you can do that if you want. You want to first increase your duration. So going from 10 minutes at a time to 15 to 20 up until 30 minutes. Once you've hit your duration goal, then you increase the intensity. And I have a lot of patients ask me, when can I increase the resistance on my stationary bike? Once you've met your time goal. Next thing on this chart, you want to benefit your muscle mass and strength. How do you do so? Well, they recommend free weights, weight machines, and TheraBands. Well, how do you achieve strength increase with those types of exercise? You want to perform those exercises at a resistance of 60 to 80% one repetition max. And I don't even know if I described it that well before, but I'm going to go over it right now. To perform any range of motion one time with a large amount of resistance and not be able to perform it again because you fatigued is your 1 rep max. So like I was saying before, if the heaviest weight I can lift with my arm is 20 pounds, and now like, whoo, I am so fatigued, my arm is done. That was the max amount of weight I could lift. That is the max amount of biceps curl or elbow flexion I can do. Now to exercise, I want to take 60 to 80% of that 1 rep max and use it as my weight, my resistive weight. You want to try to perform 8 to 10 repetitions, 8 to 12 repetitions of each exercise and 8 to 10 different exercises. So what I typically give my patients is 2 sets of 10, and we will start off at 5 to 6 different exercises, and we will build up to a 10 to 20 exercise program, and it's usually a full body program. You increase intensity over time. So if your 1 repetition max, say I'm getting stronger, now I can lift 30 pounds. Well, now that's my 1 repetition max. Let's take 60% of 30 pounds now and make it your new weight while you're doing your resistive training. So that's how you would improve your muscle mass and strength. Next slide. Okay, so how do you increase your range of motion and flexibility? The ACSM recommends stretching, Tai Chi, yoga, and Pilates. They recommend that you do these activities 10 to 15 minutes, 2 days a week. So when I'm trying to actually deform a contracture of a muscle, it's way more than 10 to 15 minutes, 2 days a week. This ACSM guideline is referencing increased functional mobility for enhanced joint health. It's not saying that's the prescription to get like 20 degrees extra range of motion that you've been locked out because your joint's been so contracted for so long. You need to stretch way more than that. But so for basic increase in functional flexibility and range of motion, that's their prescription. And to improve balance, they suggest single leg stands using the stability ball for seated balance strengthening, balance improvement, and core strengthening exercises. And that should be done on a regular basis, meaning every other day. There is very limited evidence showing that specific training like standing on one leg or core strengthening will directly correlate to improved balance. Improved balance is measured in how often you fall or how often you have losses of balance. Because you feel stable or you feel unstable isn't really how they measure balance in studies. It's how often did this person fall and did their falls decrease when this intervention was introduced to them. So I've read a million balance studies and I've never seen anything that was clear cut. To improve balance, you must do X, Y, and Z. It's different for every person. Another reason why going to a physical therapist is so important for an individualized program. Next slide. So just to hone in a little bit more on balance training, the effects of balance training are to enhance functional independence through increased proprioception. So sensory improvement, and coordination. I like to have people use different types of sensory input when we're practicing balance. So using sensation of feeling the ground and then visibly watching yourself in the mirror. So you're using your vision and your proprioception. I like to use task-specific performance training in different angles to mimic your functional tasks while improving your balance. But again, evidence is limited pertaining to people with rheumatoid arthritis and in the general population. Next slide. So exercises to avoid if you have rheumatoid arthritis, and this is, I think, recommended for a bunch of different reasons, but running and jumping, high impact, heavy load, high repetition activity is known to increase your risk of injury in general. I think a study showed that 97% of runners have reported significant knee pain in their lifetime, right? So it's like directly related to running. So there's that risk of injury. There's also an increased breakdown in cartilage if you are on a long-term dose of a corticosteroid. Now, when you're at higher risk of cartilage breakdown due to a chemical activity in your body, and then you put a lot of pressure and force repetitively on a large joint, you will have an increase in the risk of having no cartilage. And that's what we call it bone on bone. It's definitely something that you can replace running and jumping if you are an avid runner and you want to keep it up. And not saying eliminate it from your life, but keep it to like once a week. You can replace the cardio activity you were doing if you are a runner with aerobic activity in pools and on stationary bikes. In fact, aquatics is the hardest form of aerobic activity you can perform. You will burn 400 to 500 calories in the 30 minutes. It's a very difficult activity. Next slide. Okay, so let's talk about pain with exercise. So I just gave you an extensive list of recommendations for exercise, but a lot of people will still say, well, what if this hurts? What if I'm really fatigued? What's my limitations? And here's a few different reminders. If you are having a flare, do not attempt moderate or high intensity exercise. You can attempt resistive free aerobic activity if you have the endurance, and you can attempt gentle and isometric contractive exercises, but do not attempt moderate or high intensity exercise. If you experience any type of unfamiliar pain during exercise, stop. And that's when you would message your physical therapist. Unfamiliar pain would be something that wasn't there before you started the activity. So if you're having dull aches in your joints and that dull ache is sustained throughout your exercise, that is okay. If that dull ache is now increased either during the exercise activity or directly following the exercise activity, no good. So that's the difference between your common pain and an unfamiliar pain. Muscle soreness is expected. Everyone gets delayed onset muscle soreness, especially when they're starting a program, starting a new activity, or increasing their resistance. But that muscle soreness should significantly decrease 2 to 3 days after it began. So if you're having muscle soreness for 4, 5, 6, 7 days after an activity, no good. Your therapist should, and hopefully will, decrease your resistance, decrease your frequency. I usually tell my patients, cut it in half. Okay, you did 20 reps of this, now we're just going to do 10. Okay, you did 5 pounds of resistance, let's do 2. So significant decrease in resistance and frequency. So just to review, pain is no good if it begins during the activity or directly following the activity. Next slide. Okay, so now we get to do some exercises. I think that we're going to do questions. I only have a couple of slides of exercises. We're actually almost done. I only have 4 slides of exercises. And so I hope that everyone saved their questions and or jotted it down, because we're going to be doing this for like 5 to 10 minutes, and then I'll take all your questions. So I'm going to push my computer away a little and go back. I don't even know if we could see. I think I'm going to have to move the computer so you can see my legs, or stand up maybe. Okay, so the first exercise is done in the chair. It's seated knee extension. This exercise is just for strengthening and re-education of the quadricep muscles, these 4 muscles in the front of your thigh. This is important to maintain flexibility of the knee joint. I suggest doing this 10 repetitions before you stand up after being seated for any period of time greater than 20 minutes. So if you're sitting out to dinner for an hour before you get up, do this stretch. If you're rising out of bed in the morning, do this stretch. This is something you want to keep your joint lubricated by doing all day. So pretend I'm sitting and I would just straighten and bend my leg. You're going to hold the leg in extension for 2 seconds. So you're just going to 1, 2, and bend. You're going to do that, like I said, 10 repetitions on each leg throughout the day after you've been sitting for as long as 20 minutes right before you stand up. It will help you with your flexibility, with your functional sit to stand, and over time will increase your quadricep strength. The next thing I want you to do when you're in a seated position is heel raises. So what you would be doing is, I'm going to actually move this down here. So feet are flat on the floor, and you would just be lifting your heels up and bringing them down. Lifting them up and bringing them down. This is another activity that you want to do throughout the day. I would recommend doing this 10 times every hour. It's good for circulation. It improves the strength of most of the calf muscles, the soleus being the main one. And it improves circulation. I think I said that already. And it maintains flexibility of the ankle joints. So just basic heel raises, you would do 10 times every hour. Seated chest expansion. So what I want you to do, this is the next exercise. I'm going to turn my chair. You're going to fix your posture so that you're as upright as you can be in a seated position. Shoulders down, ears in line with shoulders, shoulders in line with hips. You're going to stick your chest out and arch your back, and now roll back in. Stick your chest out and roll back in. You're only doing this to a level of comfort. This is to expand your chest, increasing your thoracic spine mobility. Your thoracic spine is the largest portion of your spine, and it starts at the base of your neck and runs to the bottom of your rib cage. It has the most planes of motion that any part of your spine has. It flexes, extends, side bends, and rotates. All of these vertebrae do. So keeping them flexible is important for functional independence. Again, you want to do these 10 times, and I always recommend to do this every couple of hours. So about 5 times a day. You could kind of get the theme that I want everyone to just be in continuous motion all day. Don't give your body time to stiffen up. Next slide. Ready for the next slide. Adina, are you there? Okay, there we go. Okay, can everyone hear me? Just making sure. My internet just popped up. Your internet connection is not stable. Okay, cool. So the next seated exercise is slouch over correct. Now, this exercise is very similar to chest expansion and contraction, except you're going to be rolling with your pelvis. So I'm going to turn my chair again. and I'm going to focus the camera down on my lumbar spine area. So this exercise, you're going to roll your belly button forward and you're going to roll your belly button back. So you're going to overcorrect your posture and you're going to slouch. I'm just putting my hand on the base of my spine just to make sure that you could get a visual, but like you would actually have your hands here. Pelvis rolls forward, pelvis rolls back. Again, you would do this 10 times and try to do this every 2 hours. So about 5 times a day. And again, 2-second holds. All of these exercises are pretty fluid in nature, and it's just 2 seconds forward, 2 seconds backwards. Go. And the last exercise on the slide is neck retraction. Neck retraction is to decompress, elongate, and strengthen your neck. So it strengthens the deep cervical neck flexors that support your cervical vertebrae, and it elongates the cervical spine, trying to decompress the weight of your head on the vertebrae. So from the side, you could see I'm going to place 2 fingers on my chin. I'm going to make sure that my chest is up, my shoulders are down. Go into a moderate chin tuck. So I'm going to chin tuck. And now I'm going to push my entire head and neck backwards and come back center. It's very flattering. You're going to basically make yourself have a double chin. So you're going into a half of a chin tuck, not all the way down, just a half of a chin tuck. You're going to push your whole head and neck back, double chin it. From the front, it looks like this, and relax. From the side, it looks like this, and relax. And again, I know you're going to be surprised that I would recommend you do this every 2 hours. So throughout the day, you're going to be working on your cervical spine, your thoracic spine, and your lumbar spine, your ankles and your knees consistently, because you don't want to let yourself get stiff. These are all very gentle exercises, but even though they're gentle, if they cause an increase in pain while performing or directly after, not for you. Take a few days off. If you're in physical therapy, notify your physical therapist. If you're not, try again in a few days, but do not continue with the activity, and give yourself a few days off if you have pain during, an increase in pain during, or directly following the exercise. Next slide. Okay. Next is standing exercises. Now, we can actually do the retractions in a seated posture. So this next exercise is called scapular retraction. It's a great postural re-education exercise because a lot of times we do not realize that our shoulders are rounded. We are always in forward posture because we're on the computer, we're on our phone, we're reading, we're talking, we're eating. We are functionally forward as humans. So a lot of times we don't realize our shoulders are rounded. So what I want you to do with this exercise is you're going to fix your posture and squeeze your shoulder blades together and relax. And again, it's a 2-second hold. Squeeze, 2, and relax. One thing I want you to avoid doing is elevation. So you should only be squeezing as if there's a pencil that you need to hold in between your shoulder blades. Squeeze the shoulder blades together and relax. 10 repetitions every couple of hours. If you are able to do standing heel raises, do that throughout the day, because that is a little bit more stress on your calf muscle, will provide a little bit more of an aggressive strengthening, and will promote even more increased circulation than the seated ankle pumps. Hip abduction and hip extension are next. And these hip abduction can be done in a seated position where you're just bringing the leg out to the side and back in. It is more effective in a standing posture. So I'm going to stand on up, move the computer away and back on up so you can see. Okay. Standing abduction, I want you to always be holding on to a stable surface, either your kitchen counter, a bathroom, sink, whatever you have that's not going to fall if you fall. You're going to hold on to that stable surface and you're going to kick the leg out to the side and back center. You're only going to kick as high as your leg allows you. Don't push out of your comfort zone. I'm even going to push this further so you can see my whole leg. Kick and down. You're not going to twist. You're not going to lean. You're just going to stay straight up and you're going to kick to the side. And you're going to do that 10 times. And this exercise, you're only going to do once a day, just to try to get a little bit of mobility going in the hip and a little bit of strengthening in the glutes. The last exercise is hip extension. This is probably the one exercise that you cannot do seated. You can do it lying down, but standing is what we're going to demonstrate now. You're going to, again, hold onto a stable surface. You're going to kick the leg behind you and return to center. 1, 2, center. So you're going to perform 2-second holds, and you're going to do this 10 repetitions on each leg. Things to avoid: leaning forward, arching your back. You have as much mobility, or you should use as much mobility as you have available. So as an overview, we just went through cervical range of motion, thoracic range of motion, lumbar and pelvic range of motion, hip, knee, ankle. These are not typically mobilized throughout the day. You want to start doing so. You want to start mobilizing your spine and large joints consistently throughout the day to promote functional independence, decrease stiffness, decrease pain, all of the above. I would recommend spine stretches to any patient, by the way. It is that common to have a comorbidity of a spine, flare up when you have an autoimmune condition. It's very common. In fact, I have patients that come here primarily for spine pain, and they have a comorbidity of rheumatoid arthritis, and they're small joints and their immune system is pretty much regulated, but they just, they blew out a disc in their neck. So this is very important to partake in and get into a healthier, more flexible lifestyle. The next slide. Oh my gosh, I am so sorry. We did not do shoulder extension. Okay. Another large joint that you should be working on. Shoulder extension, standing. You're going to extend your arm back and center. 10 repetitions, holding for 2 seconds each. Shoulder is another large joint in the body that you want to keep mobile. You want to decrease your risk of stiffness and pain. That as well, I would recommend to do every day. So hip extension, hip abduction, shoulder extension, every day, 10 repetitions. Everything else, every couple of hours. And now I have a little bit of the single leg stance that you could practice at home. If you want to see as a baseline how long you could stand on one leg without holding on to a surface, but just in front of a stable surface so you could quickly hold on if you lose your balance, that's a nice way to test balance improvement or risk of fall decreasing. You get a baseline. How long can I stand on my right leg? 5 seconds. How long can I stand on my left leg? 10 seconds. Exercise for 4 to 6 weeks. Repeat the single leg stance test. Oh, now I doubled my stance time. On my right leg, I am now standing for 10 seconds. On my left, now I'm 15. That's a nice way to measure your growth and measure your sensory input education. But again, limited evidence, but I did want to put that in there for proprioceptive awareness activity at baseline. And I think that is it. Let's see the last slide. There's my email address if any of you have any questions, or if any of you live in Manhattan and would like to see me for an eval, just reach out to me at that email.